When you find yourself battling a persistent cough that seems to linger for weeks, it might be more than just a common cold. For many, bronchitis, an inflammation of the airways leading to the lungs, can become a recurring and debilitating issue. While acute bronchitis might resolve on its own, chronic bronchitis can signify deeper health challenges, including chronic obstructive pulmonary disease. Left unmanaged, bronchitis can disrupt daily life, cause severe respiratory distress, and even lead to life-threatening complications. In this article, we explore the complexities of bronchitis, its causes, symptoms, and management strategies, all while shedding light on the urgent need for timely intervention and proper care. If you find this information valuable, consider subscribing to our YouTube channel, Dr. Mai, sharing medical knowledge. By liking, commenting, and subscribing, you help us continue to create content that empowers you with essential medical insights. Bronchitis occurs when the airways, the trachea and bronchi, become inflamed and filled with mucus. This inflammation triggers a persistent cough as your body attempts to clear the mucus from your respiratory system. While the condition might appear as a simple annoyance at first, it can evolve into a prolonged struggle if left untreated. Bronchitis is broadly categorized into two types, acute and chronic. Acute bronchitis, typically caused by viral infections. Acute bronchitis is a temporary condition that generally resolves within a few weeks. It often accompanies or follows a respiratory illness, like the flu or a cold. While acute bronchitis usually requires minimal medical intervention, its symptoms, persistent coughing, fatigue, and chest discomfort, can significantly impact your quality of life. Chronic bronchitis, a more serious form of bronchitis. Chronic bronchitis is characterized by a cough that produces mucus for most days of the month, lasting for at least 3 months a year over 2 consecutive years. Chronic bronchitis is often linked to long-term exposure to irritants like tobacco smoke or air pollution and is a key component of COPD. Unlike acute bronchitis, chronic bronchitis rarely resolves completely, requiring ongoing management to control symptoms and prevent complications. Bronchitis can affect anyone, but certain factors increase the likelihood of developing the condition. Individuals who smoke or are frequently exposed to secondhand smoke are at the highest risk. Chronic exposure to air pollutants, occupational irritants, or respiratory infections can also predispose individuals to bronchitis. Additionally, people with underlying conditions such as asthma, GERD, or autoimmune disorders are more susceptible. The hallmark symptom of bronchitis is a nagging cough that can last anywhere from a few days to several weeks. While coughing, you may produce mucus, which can vary in color and consistency. Other symptoms may include shortness of breath, wheezing or a whistling sound when breathing, chest discomfort or tightness, fatigue and body aches, fever and chills in some cases. Acute bronchitis is most often caused by viral infections, including influenza and the common cold. In rarer cases, bacterial infections or exposure to environmental irritants can trigger the condition. Chronic bronchitis, on the other hand, is primarily linked to prolonged irritation of the airways due to smoking or environmental pollutants. Diagnosing bronchitis typically involves a thorough review of your symptoms and medical history. Your healthcare provider may perform a physical examination, listening for wheezing or other abnormal lung sounds. Diagnostic tests, such as chest X-rays, blood tests, or sputum cultures, may be conducted to rule out other conditions like pneumonia or asthma. Acute bronchitis usually resolves on its own without specific treatment. However, symptom management is crucial for comfort and recovery. Common approaches include hydration. Drinking plenty of fluids helps thin mucus, making it easier to expel. Rest. Allowing your body time to heal is essential. Over-the-counter medications. Pain relievers like acetaminophen and ibuprofen can reduce fever and discomfort. While cough suppressants may help alleviate persistent coughing, steam and humidifiers, moist air can soothe irritated airways and improve breathing. For chronic bronchitis, treatment focuses on managing symptoms and preventing further damage to the lungs. This may involve bronchodilators, medications that relax the muscles around the airways, making breathing easier, anti-inflammatory drugs. Corticosteroids may be prescribed to reduce airway inflammation. Pulmonary rehabilitation. A program of exercise, education, and support designed to improve lung function. Lifestyle modifications. Quitting smoking and avoiding pollutants are critical for preventing flare-ups. Unchecked bronchitis can lead to serious complications, particularly in individuals with weakened immune systems or pre-existing respiratory conditions. Chronic bronchitis, in particular, can contribute to the progression of COPD, resulting in long-term disability or even respiratory failure. Acute bronchitis can sometimes lead to pneumonia, especially in older adults and those with compromised health. Preventive measures include getting vaccinated against influenza and pneumonia, washing hands regularly to reduce the risk of infections, avoiding exposure to tobacco smoke and environmental irritants, maintaining a healthy lifestyle with a balanced diet and regular exercise. Bronchitis is more than just a bothersome cough. It's a condition that, if ignored, can lead to severe health consequences. By understanding its causes and symptoms, you can take proactive steps to manage and prevent it. Remember, your health is your greatest asset. If you found this article informative, please support our efforts to spread medical knowledge by liking, commenting, and subscribing to Dr. Mai. Sharing medical knowledge. Your engagement helps us continue to provide valuable insights into health and wellness topics. Together, let's build a healthier future.